A very good evening to everyone, guys. A warm welcome to everyone. This is Dr. Azam here right now, Faculty of Anatomy, and I hope you people are all with me, along with me here. We'll just wait for another like 1 minute here right now. Let the other people join. Yes, guys. So I think you people are along with me from last like 2 days. Day 4 yesterday we have completed upper limb topic, and then we have done with the other topics like head and neck also. And yesterday we have done like exclusively neuroanatomy in detail along with the embryology part. And now, my dear friends, welcome today. This is the last and final rapid revision session of anatomy just before your exam, guys. So your exam scheduled on 31st. So hope all this discussion that we're doing here is really helping you all. You know? And now, my dear friends, let me just till like all the other students join there in another 1 minute. Let me just introduce you right now on an academy. I'm like really happy to tell you people that we are going to start with entire batch course for FMGs. So that is going to begin from September onwards, okay, September 5th onwards. And I'm going to of course take anatomy in that one. We'll be having all like 19 subjects, so with like the test and discussion for subject wise test, and finally the grand test, and everything will be there in that course. So you can finally go on the website, an academy website, and check for all the details of that one. And whenever you're paying, don't forget to use my code for additional 10% discount. It's simple, Dr. Azam, a short and sweet name, AZAM, along with 10, Dr. Azam 10. Fine. So with all this, let's do one thing. I think all of them have joined along with us right now, guys. And now let's begin with our today's topic. That is our thorax topic. So today I'm going to discuss along with you people thorax, and then abdomen topic. I'm going to discuss the pelvis and perineum topic, as well as the lower limb topic, guys. And in all these topics today, let us discuss about all the high yield stuff, guys. The topics that are like must know topics before going to your exam. So before going to your exam, you have to revise all these topics. So let us revise all this one here right now, guys. So just let me know, everyone here. Are you all ready? Shall we begin? Are you all ready with your pen, papers, everything to write down? Yes. So the first topic to begin here right now is your thorax topic. And in the thorax topic, the very first topic that you have to begin, that you have to know, is intercostal space, guys. So in between the ribs, you have got the intercostal space. I'll make it like simple for you. Listen here very carefully. And I think I don't have to tell you like again and again. Almost we are meeting daily, and this is the last day that we are meeting on this, rapid revision session of anatomy. I think I don't have to tell you that daily, guys. Another 1 hour, you are completely along with me, guys. Forget about everything in your life. Completely be along with me right now. Okay, and whatever I'm telling you, please note down roughly there. Come on. So in the intercostal space, I am telling you, you've got to remember only like 3 points here right now. So only 3 points you have to remember here. Point number 1. In the intercostal space, you have to remember about the muscles. Yes, you have got the external intercostal muscle. There will be an external intercostal muscle. Okay, there will be an internal intercostal muscle, and then you have got the innermost intercostal muscle, guys. Point number 1. Only 3 points. Point number 1. External intercostal muscle, internal intercostal muscle, and innermost intercostal muscle. Point number 2. In between the internal intercostal muscle and the innermost intercostal muscle, guys. In between the internal and innermost, in between them, you are able to find all that neurovascular bundle, guys. The nerve, artery, and the vein. The neurovascular bundle is present between the internal and innermost intercostal muscle. Between that. And please don't even learn the name of the nerve, artery, and the vein there. You just have to learn their arrangement. Yes, can you see there? First of all, you'll be having intercostal vein, followed by intercostal artery, and followed by the intercostal nerve there, guys. So it is in the form of VAN van, above downwards, upar se niche, pai nunchi kinda varaku. Is it okay? So let us revise again very quickly, guys. In the intercostal space, point number 1, muscles. External, internal, innermost, intercostal muscle. Point number 2, where do you have the new I and IM, internal and innermost? And what is the arrangement? It is in the form of VAN van. But remember, the arrangement is VAN van except for the first intercostal space, guys. Arrangement is VAN van except the first intercostal space. And in the very first intercostal space, you have to make it opposite. It will be like nerve, artery, and vein above downwards. You have to just make it a reverse, ulta, nerve artery in the vein, above downwards, the first intercostal space. Okay, so that is something important for you to remember here in the intercostal space topic, guys. Welcome to the second topic. So this one you have to revise for your exam. Now, out of that intercostal vein, artery and the nerve, okay, the vein is at most important, guys. Intercostal vein topic is at most important for your MC exam. Now I'm going to deal with the azygous venous system, azygous, hemiazygous, and accessory hemiazygous, and many of the students have a a lot of confusion in this topic here. तो चलिए हम लोग ना इसको simple बनाते हैं. Let us make it simple. Intercostal vein topic, you can see here. Now, my dear friends, in this diagram, you are able to see this one will be your right brachiocephalic vein. I'm just writing in short as BC, don't take me wrongly. It is right brachiocephalic vein, and this one will be your left brachiocephalic vein here right now, guys. This one will be the left brachiocephalic vein here. So this one will be the left brachiocephalic vein. Now these two will join together to form your superior vena cava, and then this one here will be your inferior vena cava. Fine. And now I know very well that each and every medical student know about this one here right now, guys. No problem with this one. And now welcome to the next concept here right now. There is a vein known as azygous vein. Now why the azygous vein is known as azygous vein? What is the reason why the azygous vein is known as azygous vein, guys? Azygous means, remember, unpaired. What is the meaning of azygous, Navneet? It is unpaired. An unpaired single, and remember, single, it is only on the right side of the body. Okay, azygous vein is only on the right side of the body here right now. And this one that you're able to see here, this is your azygous vein. This one will be your azygous vein here right now, guys. Okay, and you can very clearly see in my diagram here right now, okay, azygous vein is going to go and drain into the superior vena cava. Okay, azygous vein is going to drain into the superior vena cava, guys. Done. After that, what else do you have to remember? Yes, on the right side here right now, you'll be having like so many intercostal veins, posterior intercostal veins. Out of that, posterior intercostal veins on the right side, few of the veins are going to combine and they are going to form a vein that is your right superior intercostal vein. Right superior intercostal vein. Okay, and that will also drain into the azygous vein on the right side. And similarly on the left side also you'll be having like few of the posterior intercostal veins, and they are going to combine to form left superior intercostal vein. But the problem is that, do you have azygous vein on the left side? No, you are not having the azygous vein on the left side. Azygous ka matlab kya hota hai? What is the meaning of that one? That is your unpaired guys, single one, only on the right side. So remember, on the left side you don't have azygous vein, so therefore the left side one will drain into the left brachiocephalic. That's something important. I'll repeat again here right now. Left superior intercostal vein. Yes, listen here guys, I'm going to repeat here once more. There is a right superior intercostal vein, and that right superior intercostal vein will drain into azygous vein present on the right side. But the left superior intercostal vein will be draining into the left brachiocephalic vein, guys. There is no azygous on the left side there. Sir, what about the other veins here right now? There'll be some other, intercostal veins. They are going to drain into your accessory hemiazygous vein. And this accessory hemiazygous vein, as you can see on the screen there, it is going to cross onto the other side and it will drain into azygous vein. And there'll be some more veins here right now, and those veins are going to drain into your hemiazygous vein. Into the hemiazygous vein, and even that is also going to cross on the other side and it will also drain into the azygous vein, guys. Lovely. Understanding here right now? So let's see what is the question asked in the exam. Come on guys, question number 1. Accessory hemiazygous vein will drain into azygous vein. Hemiazygous vein will drain into azygous vein, and then right superior intercostal vein, it will also drain into azygous vein. I repeat again, accessory hemiazygous, and the right superior intercostal vein will drain into azygous, except what? Except the left superior intercostal vein, guys. Except the left superior intercostal vein. And after my session today, you can go back and check in the previous year MCQs, guys. Don't think that, Dr. Azim is teaching something in depth here right now. Will it be really asked in FMG exam, MC exam? Yes, my dear friends, this question has been asked. All the following veins will drain into azygous vein except one. Accessory hemiazygous, right superior intercostal vein, all of them will drain into azygous except the left superior intercostal vein. Lovely. So one of the most difficult, diagram here right now. You can see how difficult or complicated this diagram is, and this diagram has been made simple. Is it okay, my dear friends? Okay, that will be draining into the left brachiocephalic vein. Okay, and now someone is asking, sir, why only the left superior? Why? Because on the left side you do not have azygous vein. Azygous means unpaired only, and it is only on the right side there. On left side you don't have any azygous vein there. So left side will be draining into the left brachiocephalic vein. Next one here. After learning the concept of intercostal space, and after learning the concept of intercostal vein, azygous system, entire azygous system there, and now my dear doctors, welcome to the topic of heart right now. And the heart topic, your MCA examiner is a lot interested in yes, the boundaries, the apex of the heart, the base of the heart, it is formed by what and all. Yes, in this diagram you're able to see this is superior vena cava, and this one will be your inferior vena cava, and both of them are going to drain the blood into right atrium. From the right atrium the blood will go to right ventricle. Behind here that will be your left ventricle here right now, guys. Lovely. Now you can look at this diagram and answer here, what is the apex of the heart formed by? Apex of the heart will be formed by your left ventricle here. Lovely. If that is the apex there, guys, this will be the base of the heart. And you can clearly see in the diagram there, the base of the heart will be formed by your right atrium, and behind the right atrium what you have, guys, even left atrium also. Try to understand there. Most of the students are getting confused here. I don't know why. I'm asking you like the complete base, guys. I'm not asking you the border. So some of the students are just telling that base is formed by right atrium. Na, मैंने आपको क्या पूछा है? मैंने आपको पूछा है complete base, not the border, guys. So complete base is formed by the right atrium, and behind you have got the left atrium also. And suppose in the exam if they give you both the options, then remember right atrium is going to contribute 1/3 and the left atrium is going to contribute 2/3. So if both the options are given, remember the better option will be your left atrium, guys. It is contributing more for the base of the heart. If you have learned the apex and base, now my dear friends, welcome to the inferior surface. Wow, ये तो बड़ा आसान है. It's like easy. I can clearly see the inferior surface partly contributed by right atrium, and it is also contributed by your right ventricle, and it is also contributed by your left ventricle partly, guys. That is your inferior surface of the heart. And now what about the lateral surface of the heart, sir? The lateral surface of the heart will be contributed by left ventricle. And yes, this ear-like structure here right now, this one will be your left auricle, guys. There is an ear-like projection known as auricle, that is your left auricle. Done. And now one of the most important thing in your MCA exam is what about the right border of the heart? Remember, right border, this time I'm asking just the border, not the complete surface, guys. And remember the right border of the heart, it is only and only contributed by the right atrium. Now I'll tell you one more question here right now. What about the right cardiac shadow? I think before 1 year, 2018, they have given a chest X-ray. In that X-ray they have asked what is going to form the right cardiac shadow. And remember the right cardiac shadow is formed by all the three of them, that is your SIR, sir. I mean to say the superior vena cava and the inferior vena cava and the right atrium, guys. I repeat again, superior vena cava, inferior vena cava and the right atrium. So please be like really careful. Are they asking only the right border of the heart, or are they asking the right complete cardiac shadow? Right border of the heart will be only right atrium, and the right cardiac shadow will be formed by superior vena cava, inferior vena cava and the right atrium, guys. SIR, sir. Lovely. I hope all of you are comfortable here right now. Are you able to revise all these topics? Yeah. So this is like our last and final session today, guys. We'll finish it off with the rapid revision session, and I think this will be like really helpful for all the students who are preparing for the exam on 31st August 2020. Is it okay? So all these topics are very high yield topic. You have to know these topics and go to the exam. Otherwise throw your hall ticket somewhere where you can't find and don't go to the exam, guys. These are must know topics. आपको पता होना चाहिए. Now my dear friends, that's about the heart. Welcome about the root of the lungs. Yes, this is the right lung here right now, and this will be the left lung here right now, my dear friends, and this is the root of the lung. And what are they asking in the root of the lung here right now? What are they asking in the root of the right lung here right now and the root of the left lung? Arrangement of the structures. Above downwards and antero-posterior. They're asking the arrangement of the structure, guys. Okay, arrangement of the structures. Above downwards and antero-posterior. They're asking the arrangement of the structures there, guys. Okay. Now, where will be the artery, where will be the bronchus, and where will be the veins? Let us see here right now. I hope you're able to appreciate in the diagram there. In the left lung, first of all, let's go above downwards. ऊपर से नीचे, पाई नुंचे किंद वरकू. सबसे पहले ऊपर क्या होगा? First of all, what do you have there, guys? First, you'll be having the pulmonary artery there. Just below the artery, I hope you're able to appreciate the bronchus there. And below that, you'll be having the two pulmonary veins. Okay, above downwards. Artery, the bronchus, and the vein. Yes, one of our friend is having, oh my goodness, what is that name? Moy Rang. Oh, bye. So Atal Bihari Vajpayee. Okay, now artery and the bronchus and the vein. Atal Bihari Vajpayee. Okay, you can remember that. And my dear friends, what about the left lung? In the left lung, above downwards, ऊपर से नीचे. In the right lung, what do you have? What happens here right now is that there will be artery, pulmonary artery तो होता है. But on the right side, I hope you have learned in your first year MBBS days, my dear friends. Okay, on the right side, the right primary bronchus will be dividing just before entering into the lung only. Before entering into the lung, it will be dividing. So one will be above the artery, eparterial bronchus, beautiful name given by the doctors. It is above the artery. And another one will be below the artery, and that will be your hyparterial bronchus, guys. That will be the hyparterial bronchus. So one is above the artery, eparterial, and another one will be hyparterial bronchus. And then, yes, pulmonary veins will be at the same place. So that is how the arrangement is in the right lung, root of the right lung. That is why they're asking this topic in the MC exam. You can see the arrangement there, guys. It is different in the right lung and left lung. Right lung or left lung, dono mein different hai. So please remember that arrangement above downwards. So artery, bronchus, and the vein. Achha, what about the antero-posterior, guys? Antero-posterior, it is actually same. I'll just write down here from anterior. If you're going towards the posterior, in both the lung, right lung and the left lung, सबसे पहले ना आपको होगा vein. First you'll be having the vein, and then you'll be having the pulmonary artery, and then you'll be having the bronchus. So there'll be like vein and then artery and the bronchus. Vein, artery, and bronchus, guys. That is the arrangement, anterior-posteriorly, both in right lung and the left lung. Both in right lung and the left lung, it is the same, guys. Thank God. Okay, and because it is like almost the last moment, guys, so let me just give you one small mnemonic here. Antero-posteriorly it is vein, artery, and bronchus. Above downwards it is artery, bronchus, and vein. So I'm telling you like everything possible so that whatever you love, in whatever way you want to remember, you can remember in that way, guys. Is it okay? In whatever way you want to remember, you can remember in that way. Okay, so VAB and then ABV, guys. So somehow this might help you in the exam. Now why I have selected this topic here right now for your discussion today here right now. Now my dear friends, already this question has been asked in the exam. Observe the root of the right lung here. Above this root of the right lung, are you able to appreciate one depression there? There's some impression here right now. Are you able to appreciate this impression here right now? Yes, that has been asked in the exam. Okay, this impression is created because of what? It is because of which structure? And remember, my dear doctors, that will be the arch of azygous vein. Arch of azygous vein. Okay, arch of azygous vein. And you can clearly see just now, few minutes back, I taught you azygous vein will go and drain into superior vena cava. Lovely. Is it okay? And now can you see the impression here also, guys, in the above the root of the left lung? Above the root of the left lung, can you see one depression here or impression here right now? Yes, that is due to the arch of aorta here right now. That is arch of aorta. Beautiful. So right side, see, whatever I'm telling you here right now, it's like very well planned, guys. I told you already, azygous vein is unpaired and it is single, it present on the right side. So above the root of the right lung, you remember arch of azygous, and above the root of the left lung, yes, always will be drawing the arch of aorta towards the left side only. So definitely towards the left side, it will be arch of aorta, guys. Arch of aorta. Are you understanding, my dear friends here? So that has been already asked in the exam. Take care about all these topics here right now, guys. So I'm dealing with all the difficult topics where the students will be having difficulty and all the high yield topics, guys. So at least to try to listen to my video here right now. After the class also, it will be available on YouTube, guys. number of times you listen that and keep this in mind and just go to the exam. Definitely there'll be questions coming from all these things we are discussing, and yes, you will come out with flying colors. I believe in you. Okay, so chalo sir, these topics has to be learned here. And now let's move towards the embryology part here right now guys. अब हम बढ़ेंगे embryology part के तरफ में. Okay. In the cardiovascular system embryology, CVS embryology, the first topic that you have to remember is development of heart. Okay. Now remember here right now, development of heart begins on which day? Remember, development of the heart begins on the 16th day. 16th day. And remember about the heartbeats. Heartbeats during intrauterine life will begin when guys? It is going to begin during the 4th week onwards. Okay? So these two are like direct MCQs here right now. Development of the heart formation is going to begin from 16th day onwards, and heart will begin beating, heartbeats will begin by 4th week onwards. Okay now, Deepak Yadav, I want to cover as many points as possible here right now, because the time given to us is like almost 1 hour. In 1 hour I want to cover everything, and it's like rapid revision, so this should help yes, to the students who are going to attempt the exam on 31st, है ना. So Deepak थोड़ा सा cooperate करो यहाँ पर, ठीक है. Now my dear friends, development of the heart क्या होगा? Initially you'll be having like 2 heart tubes. There'll be 2 primitive heart tubes. Okay. And these 2 primitive heart tubes, what will happen? Those heart tubes are going to fuse together. These 2 heart tubes are going to fuse together. Okay, now I'll tell you a little bit here right now, listen carefully. And once they fuse together, yes, the cranial end you'll be having truncus arteriosus, and the caudal end you'll be having sinus venosus, guys. Okay, the cranial end will be completely fused actually. The cranial end will be having truncus arteriosus, and the caudal end will be having sinus venosus. And I will now tell you the trick. I will now tell you the trick here right now, guys. Exactly, okay, how to remember this and how to make this topic easier here right now. सबसे पहले ना आपको यहाँ पर identify करना होगा. First of all, you have to identify here that which is the part from where the blood will enter, inflow, and which is the part from where the blood will come out, outflow, guys. Inflow and outflow. And I'll tell you the trick here right now. Look here, डॉक्टर्स ने ना ऐसे ही नाम नहीं दिया है सर. डॉक्टर्स ने ऐसे ही नाम नहीं दिया है. साइनस विनोसस का मतलब क्या होता है? वीनोसस. वीनोसस अंटे एंटी. यस, वीनोसस वीनस, एंड फ्रॉम देयर द ब्लड इज गोइंग टू एंटर. And truncus arteriosus means what, guys? It is the place which is actually the outflow, and from there the arteriosus. From there the blood is going to move out, guys. Okay, so don't try to mug up. I hate that thing, guys. Okay, now I've seen like thousands and thousands of students just start sitting at their home. Truncus arteriosus, bina samjhe na, truncus arteriosus, truncus arteriosus. Try to understand and learn. No mugging business in my classes. When you attend my regular classes, you'll come to know there's no mugging business. Everything will be like very much conceptual. So sinus venosus, venous, the blood is entering, inflow. Truncus arteriosus, artery, from there the blood is going to move out. Now what you do is compare this embryology part with the gross anatomy. Compare this embryology part with our body, that is your gross anatomy, guys. Yes, right now in your body and in my body, tell me which blood vessels are going to carry the blood outside from the heart. Number 1, it's your aorta, and number 2 will be the pulmonary trunk, guys. Number 1 will be aorta, and number 2 will be pulmonary trunk. Those two are actually the outflow right now, gross anatomy part in our body. Yes, they should be definitely developing from where only? Yes, they should be derived from your truncus arteriosus. So truncus arteriosus is going to form what, sir? The ascending aorta. Along with ascending aorta, it is going to form the pulmonary trunk, sir. Beautiful. That's the way how you remember embryology. Embryology, I'll make it like damn easy, guys. Just join my classes. Sinus venosus. Sinus venosus is nothing but the venous part, the inflow part. So inflow part, from the heart, blood is collected by coronary sinus, and that is going to develop from where, guys? That is going to derive from sinus venosus. So sinus venosus is the one which is going to form your coronary sinus, the inflow part, guys. And one addition that you have to make here right now, I told you the lower part, that is the caudal part, sinus venosus part. It is not, fused. There'll be 2 different parts. One will be right horn, another one will be the left horn. And my dear doctors, remember, left horn is the one which is going to form your coronary sinus. I repeat again, left horn of the sinus venosus is the one which is going to develop into your coronary sinus, guys. Lovely. Okay, now, एक बार दोबारा करेंगे. I don't know about you people. Yes, my dear friends, I think you are, understanding here right now. You're getting here right now, है ना? Now, my dear friends, welcome here right now. Truncus arteriosus, the cranial part. Arteriosus, yes, it is actually what, guys? Outflow. Outflow means nothing but it is going to form what, sir? Ascending aorta and pulmonary trunk. Sinus venosus, venosus is the inflow part, and inflow part will be, yes, it is going to form your coronary sinus. That to which horn? The left horn, sir. Awesome, done. And don't even worry about the middle part. The middle part here right now, all this, dilatations, that is bulbus cordis, the primitive ventricle and the primitive atrium, all of them are going to form your chambers, that is ventricles, right and left ventricle, and the atria, guys, right and left atria. Lovely. The middle part is going to form your the chambers. Okay. Patel, no, I will tell you about the inferior vena cava and superior vena cava within 2 minutes, Patel. Hold on. Okay, so these are the points to be remembered in the development of the heart, sir. Done. Acha, one more point I want to tell you people here right now. Is it okay? Listen here. Truncus arteriosus is the one which is going to form the ascending aorta and the pulmonary trunk. And remember, yes, how they are separated. In the middle of these two, there is a formation of septum. And that septum is known as spiral septum. Truncus arteriosus क्या form करेगा? Ascending aorta और pulmonary trunk. अब ये दोनों एक दूसरे से separate कैसे होते हैं? With the help of a septum. And that septum is known as spiral septum. Another name of this one will be your aorticopulmonary septum. Aorta and pulmonary trunk. That is why aorticopulmonary septum. And yes, already I taught you yesterday only, our last topic yesterday, this that spiral septum will be derived from where? Remember, that will be derived from neural crest cells. Spiral septum will be derived from where? That is derived from the neural crest cells, guys. Neural crest cells se wo derive hota hai. Lovely. That completes all the points here right now in, yes, development of the heart, guys. Okay, fine. अभी के लिए आपको ना इतने पॉइंट्स पढ़ने होंगे. इन डिटेल विल डू इन अवर रेगुलर क्लासेस. नाउ वेलकम टू द नेक्स्ट पॉइंट, नेक्स्ट टॉपिक सर. द नेक्स्ट टॉपिक, यस पटेल, आपने कहा और हम ये टॉपिक के साथ में हाजिर है. वेलकम टू डेवलपमेंट ऑफ द वीनस सिस्टम. Welcome to the development of the venous system here right now, sir. Now, my dear doctors, I hope you are able to see here. There is a developing heart here right now, guys. Heart is forming here. Okay, ना थोड़ा ध्यान से सुनना. During development, my dear doctors, there will be 3 veins. There will be 3 set of veins. There will be 3 different set of veins. Number 1, are you able to see that there is a cardinal vein here right now, guys? Cardinal veins are going to collect the blood from the entire embryo. Yes, I can see here the anterior cardinal vein. Okay, and then there will be a posterior cardinal vein. Okay, and both of them will combine to form your common cardinal vein. Now you have cardinal vein, and cardinal vein is going to collect the blood from where only? From the entire part of the body, entire part of the embryo. Again, do the same thing. Learn in my way, in my style. If cardinal vein is collecting the blood from the entire embryo, compare the embryo with our body right now. In our body, entire body blood is collected by vena cava. So that is the reason why cardinal veins are the one which are going to form superior vena cava as well as your inferior vena cava. Awesome. It can't be much more easier than this one, guys. It can't be much more easier than this one, I'm telling you. I repeat again, cardinal veins are going to collect the blood from the entire embryo. Compare the embryo with our body right now. It's our entire body. The blood is collected by vena cava. So vena cava has to definitely develop from where only? Cardinal vein, guys. One thing done. Number 2, you can see here, this one will be the yolk sac, guys. If this is your yolk sac here right now, I hope you all know that yolk sac is going to become your future gut. The foregut, midgut and hindgut, everything. Yolk sac is nothing but your future gut, guys. Now, who is collecting the blood from yolk sac? Vitelline vein in embryo. In embryo, vitelline vein is going to collect the blood from the yolk sac. समझ में आ रहा है बच्चों? अर्धम आवतुंदा लेदा मेको. Yes. Okay. Now, the vitelline vein is going to collect the blood from the yolk sac. Okay, in the embryo. With the, yes, our body right now. In our body, who is going to collect the blood from the gut? Yes, that is nothing but your portal vein. तो portal vein बोलो बच्चों कहाँ से derive होगा? Portal vein will be derived from vitelline veins. Awesome. ठीक है जी. So cardinal veins are going to form Cardinal veins are going to form your superior vena cava and inferior vena cava, and the vitelline veins are going to form the portal vein, guys. That's the easy way to remember. And now welcome to the hot favorite of your MCA examiner. That's your umbilical vein, guys. Umbilical veins are like hot favorite, and I'm expecting that question in the next exam. 31st August, this question is gonna come in your exam, guys. Okay, umbilical veins, पक्का ये क्वेश्चन आने वाला है. ఖచ్చితంగా ఈ క్వశ్చన్ వస్తుంది కందిప్పవరం ఎగ్జామ్ లా. Now listen to the question right now, guys. Umbilical vein story. What is the fate of umbilical vein? Now during development, guys, before the birth, you'll be having two umbilical vein. One will be the right umbilical vein, another one will be the left umbilical vein. Before birth, during development, there will be a right umbilical vein, and then that will be left umbilical vein, guys. And remember, out of these two, the right umbilical vein will regress, and only the left umbilical vein is left there. So remember, right regress, left is left. Right regress, left is left, sir. So right umbilical vein is gone, only left is there. And left wala kya karega? What is left umbilical vein doing, sir? It will be carries oxygenated blood. Even this was asked in your MCA exam. It carries oxygenated blood from where, sir? From mother to the developing fetus. This has been already asked in the exam. Even oxygenated blood bhi pucha gaya tha, sir. And from where to where? From mother to the fetus. Even that was asked in the exam. Too much. So therefore, my dear doctors, before birth, you'll be having two umbilical vein, right umbilical vein, left umbilical vein. Right regress, and the left umbilical vein will be remaining. It is going to carry the oxygenated blood to the developing fetus. Okay. Now the development is going on, and finally the day comes when the delivery of the baby occurs. Good news. And we are the doctors who are going to cut the umbilical cord. And the moment you cut the umbilical cord, there is no connection between the mother and the baby. And if there is no connection between mother and the baby right now, tell me, my dear friends, is there any use of left umbilical vein after the birth? No use. So after birth, what is the fate of left umbilical vein? Left umbilical vein will be obliterated. It will be closed. And that obliterated left umbilical vein is now present in your body also and my body also, and that is in the form of ligamentum teres. This is the question that I'm expecting on 31st August 2020, guys. Ligamentum teres is the remnant of what? It is a remnant of left umbilical vein. That's a very important question, guys. Ligamentum teres is the remnant of left umbilical vein. Yes, that is going to come in your exam. Take care about that one. You have to remember. So that's the entire story about your umbilical veins. I think the development of all the three sets of vein, cardinal vein, the vitelline vein, and the umbilical vein, is like crystal clear to all of you guys. Okay, lovely. Done. Now, after completing this, the fate of, all your umbilical veins here right now, let us go to the next topic. That is what you have to, remember in the thorax topic. Welcome to abdomen topic here right now, guys. Welcome to the abdomen topic here right now, sir. Now, in the abdomen topic, the very first thing, nowadays, the trending topic, guys, that is inguinal canal. Yes, I hope you all know about the anterior abdominal wall. In the anterior abdominal wall, there is a layer known as transversalis fascia. And in that layer, you'll be having the oval shaped deep inguinal ring. Okay. And in the anterior abdominal wall, you have got the external oblique aponeurosis. In that, you'll be having the superficial inguinal ring. Actually, the superficial inguinal ring will be like triangle shape here right now, sir. Triangular in shape. So 2 points or 2 questions are done here right now, guys. Deep inguinal ring present in transversalis fascia, already asked in the exam. Superficial inguinal ring, triangle shape present in external oblique. Okay ना, अगर आप इन दोनों को जोड़ दोगे, if you join them together, the deep inguinal ring with the superficial inguinal ring, these two together, they are going to form your inguinal canal. Oh ho 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 ho. समझ आ रहा है sir? So the deep inguinal ring and the superficial inguinal ring, both of them will join together. Yes, that canal is nothing but inguinal canal. In your exam, your examiner is interested about the length also. What is the length of inguinal canal? Approximately 4 centimeters. To be very specific, 3.8 centimeters. Okay, that is a point to remember. And now the boundaries. And boundaries are like damn easy from our this diagram. Okay ना, इसके लिए सिर्फ नजर चाहिए. Look at this diagram according to My perspective, sir. मेरी नजर से देखो. Just look at the inguinal canal there. Look at the inguinal canal. I'll just tell you once and listen forever, guys. If this is your inguinal canal here right now, अगर ये वाला inguinal canal है, what do you have anterior to the inguinal canal? In front of that one. In front of the inguinal canal, you have got external oblique and internal oblique. Lovely. Oh. So anteriorly, you have got like external oblique, comma, internal oblique. What is forming the posterior boundary here right now? Posterior boundary, are you able to see here? These two aponeurosis will combine together. They'll combine to form conjoint tendon. Along with this fascia, which is fascia? Transversalis fascia. I repeat again, this will be your conjoint tendon and the transversalis fascia. These two together are going to form which boundary? That is going to form the posterior wall, guys. Okay, मैं दोबारा repeat करता हूँ. I'll repeat once more and it is worth repeating. They're asking questions from here. Be ready for a question from here in the next exam, guys. Inguinal canal के सामने आगे, in front of inguinal canal, what do you have? Yes, external oblique, internal oblique. Behind the inguinal canal, posteriorly, you'll be having transversalis fascia and conjoint tendon. Transversalis fascia and conjoint tendon. Now, superiorly and inferiorly are damn easy, guys. What do you have superiorly? ऊपर क्या होता है? You can clearly see in our diagram, internal oblique is arching here and going there. And then the transversus abdominis is also arching here and going there, sir. So what do you have superiorly? Superiorly, you have got internal oblique aponeurosis plus transversus abdominis aponeurosis. And after that, what do you have inferiorly here right now? There'll be a ligament, and that ligament will be your inguinal ligament, guys. There'll be a ligament below inferiorly, and that ligament is inguinal ligament. Kalas. So the anterior boundary, the posterior boundary, superiorly and inferiorly done with this diagram. ये diagram अपने दिमाग में बिठा लो, sir. So while going to the exam on 31st August, you have to look at this diagram. After completing the boundaries of inguinal canal, let us go to the next one. That is the contents. In the males, you'll be having spermatic cord along with a nerve known as ilioinguinal nerve. And in females, you'll be having the round ligament of the uterus along with the same nerve, ilioinguinal nerve. So in males, what is the content? Spermatic cord along with the ilioinguinal nerve. And in the females, it will be a round ligament of the uterus along with ilioinguinal nerve. I'll show you this diagram in the females. I think you have learned obs-gynae. And in the obs-gynae, I think you have learned about the uterus and the supports to uterus, guys. There are so many supports to uterus, broad ligament, round ligament, and you can clearly see here, this is the round ligament of the uterus going through the inguinal canal, and it will come out here and go and merge with the labia majora in the females. The round ligament of the uterus will go from there and merge with the labia majora in the females, guys. Done. So boundaries of inguinal canal, the length of inguinal canal, deep inguinal ring, superficial inguinal ring, and the contents of inguinal canal. Everything is extremely important here. Welcome to the next question here right now. Wow. Another hot favorite concept, guys. I hope you're all able to revise quickly. Come on, guys. Come on, guys. Okay, na? Today we are having like little bit of more energy here right now, है ना? आज आखिरी दिन है हमारा rapid revision session का, and I want to be like bang on. Let's discuss each and every possible question here right now. Diaphragm. In the diaphragm, remember first of all, what is the nerve supplying, sir? Phrenic nerve. ये तो सबको पता है, sir. Everyone knows that. We have been learning this from your LKG, UKG. But tell me, what is the root value of that one? C3, C4, and C5. I don't know why the students will be getting confused here right now. Phrenic nerve is supplying to diaphragm, but it's coming from where? It's coming from your C3, C4, and C5, cervical region. Keep in mind. And now you have to remember about the major openings of diaphragm. How many major openings of diaphragm? 3 major openings. Yes, I can see the inferior vena cava passing from there. It is known as vena cava opening. Swaha. I can see esophagus passing from here. That will be your esophageal opening. Swaha. And after that, I can see the aorta passing from there, and that will be your aortic opening, guys. Kya baat hai? There'll be 3 openings there: vena cava opening, aortic opening, and esophageal opening. And what do you have to remember here? Yes, you got to remember the level. Vena cava opening will be at which level? T8. Esophageal opening, T10. And aortic opening will be at the level of T12, guys. Students in the exam, what they are doing? In the exam, yes, my dear doctors, they are remembering number very nicely. 8, 10, 12. 8, 10, 12. But they are forgetting the order. Remember the order with a beautiful mnemonic here right now. The voice of America. Okay, na? Voice of America. And look at my students there. They are writing there as voice of Azam sir there. Okay, bhai, thank you. Okay, I'll take the credit. Voice of Azam sir. Voice of anatomy. So 8, 10, 12. Remember the level. And after that, यार हम सबको पता है हमारी बॉडी में इन अवर बॉडी वेन एवर देयर विल बी ओपनिंग समथिंग शुड बी पासिंग फ्रॉम देयर, है ना. सो वी हैव टू रिमेंबर कि व्हाट आर द स्ट्रक्चर्स पासिंग, व्हाट आर द स्ट्रक्चर्स पासिंग, है ना बच्चों. Vena cava opening, it is inferior vena cava. लिखो और भूल जाओ. Write down that and forget about that. They will never ask you. There's nothing to ask. Vena cava opening, vena cava. Remember, right phrenic nerve. So if I'm at your place as a student preparing for exam, I will just remember right phrenic nerve. And after that, sir, at the level of T10, that is esophageal opening, क्या पास होगा सर? Esophagus पास होगा. क्या किया जाए? लिखो और भूल जाओ. Write that and forget about that. Esophageal opening, it will be esophagus only. Along with that, remember the vagus nerve, both your right and left vagus. Wow. And I always advise the students to remember, like, esophagus, vagus, esophagus, vagus, esophagus, vagus. And now, my dear friends, if I am at your place, I will just remember right phrenic nerve, vena cava opening, and vagus nerve, that is esophageal opening. So just two things to remember. Remaining anything is given, dump them under aortic opening. Ho gaya. What is going to pass through aortic opening here right now? Aorta. Okay. Along with azygous vein. Okay. And along with thoracic duct. Along with thoracic duct, guys. Aorta, azygous vein and thoracic duct here right now, guys. Is it okay? Yes, Shankar, बोलिए आपका doubt क्या है? So remember about these three major openings. They are level and they are passing through which structure? Please remember that one, guys. Done, done, done. And you can get one question compulsory from this topic also, sir. Diaphragm topic is very much important. You can expect one question from here also. Kachitanga. Okay na? Kandippa Varam exam la. Chaliye sir. Next one. After this, my dear friends, the next topic that we are going to learn is about the abdominal aorta. Oh my God, sir. The moment you look at this diagram, abdominal aorta with branches, no, sir, ऐसे diagram हमको मत बताइए. बड़ा खतरनाक लग रहा है, branches के साथ में. परेशान मत हो सर, अभी हम जिंदा है. Yes, welcome here right now. Abdominal aorta, my dear friends. Yes, some people are asking about the minor openings also, guys. Minor openings we'll do in our, regular class. Don't worry about that. Abhi ke liye, for the rapid revision time, because we are just left out with like one day for the exam, if you at least remember the major openings, more than enough, guys. Minor openings afterwards I'll tell you in the regular class. Yes, welcome. Abdominal aorta branches, such a difficult diagram. Let me make it easy for you. Let us make this topic easy for us. Welcome to our diagram right now. First of all, abdominal aorta begins from where? T12. And right from T12, abdominal aorta will be extending up to L4, sir. T12, L1, L2, L3, L4. Lovely, done. And after that, my dear friends, we have to learn the branches. And for branches, my dear friends, abdominal aorta will give branches in every direction. Ventral, dorsal, lateral. Ventral, dorsal, lateral. Welcome to the ventral branches. Number one, right at the level of T12, there will be celiac trunk given, sir. Oh my God. That was a question in the last year, December 2019 exam. December 2019 exam, sir. Okay, na? Celiac trunk was given at the level of T12, guys. And then at the level of L1, you'll be having superior mesenteric artery. Okay, na? That is at the level of L1. And leave L2, welcome to the level of L3. And at the level of L3, there will be inferior mesenteric artery, guys. Done. So how many ventral branches are given in the front? There will be 3 ventral branches. Celiac trunk, the superior mesenteric artery and the inferior mesenteric artery. You have to remember their level also. I repeat again, celiac trunk is given at the level of T12. Superior mesenteric artery is given at the level of L1. Inferior mesenteric artery is given at the level of L3. And one more very important thing, celiac trunk is the one which is supplying to your entire foregut. Superior mesenteric artery will be supplying to the entire midgut. And the inferior mesenteric artery will be supplying to your entire hindgut. Oh my God, extremely important. Celiac trunk supplies to the foregut. Superior mesenteric artery supplies to midgut, and the inferior mesenteric artery will be supplying to the hindgut, guys. Lovely. Ventral branches completed. Welcome to the lateral branches. Lateral branches, there are totally 4 of them, and learn according to my way, my style. There'll be one artery given to diaphragm. Anything related to diaphragm, phrenic, it is coming from below inferior phrenic artery. So anything to diaphragm will be like phrenic artery. It's given from below inferior phrenic artery. Remember like that, guys. And now I'll tell you the logic here, how to remember the remaining branches. Welcome. Yes, do you have your kidney here? Of course. And if there is a kidney, do you have your suprarenal gland, adrenal gland? Of course. Yes, my dear doctors, there should be a branch given to the suprarenal gland. What is the name of this branch? Middle suprarenal artery. After that, the next one, every medical student knows, to the kidney renal artery. And the last and final, the fourth one, yes, your examiner is very much interested about this one here right now, sir. And this one will be your gonadal artery. Interested about this one, na? Gonadal artery. And remember the gonadal artery, in males it is known as the testicular artery, the same artery. The male gonads will be testicular artery. And in the female gonads will be the ovaries. So that is why the same artery is known as the ovarian artery. 2018 MCA exam, ovarian artery is a branch of abdominal aorta, and 2019 MCA exam, testicular artery is a branch of abdominal aorta. One question is definitely going to come day after tomorrow. Definitely going to come in day after tomorrow from the arterial, branches. So dhyan se padhna. And now don't ask me, sir, how do you know about all these things? It is going to come from here. Sutron ke anusar, according to the reliable sources. Welcome here. So what are the 4 lateral branches here right now, sir? Inferior phrenic artery, middle suprarenal artery, renal artery, and the gonadal artery. Okay, now? Yes. Hello, my dear doctors. Don't take me wrongly. First of all, it is like on record there. Now you might be thinking, sir is telling yes something reliable sources. Kuch nahi hai yaar. It's out of all the experience. I'm telling you. Okay. So definitely the question is going to come from here. Pata chala it's like online nowadays, bada dangerous hai na? Pata chala tomorrow morning you are like posting on the online there. You can Azam sir ko pata tha. NB people will kill me actually. How do you know that? So it's all out of experience, So ventral done and the lateral branches done. And now welcome to the dorsal branches right now, sir. Now what will be the dorsal branches? First of all, we cannot draw here. There'll be like 4 pairs of lumbar arteries. And remember, there'll be only and only one median sacral artery. There'll be only one median sacral artery, sir. Okay? So there'll be 4 pairs of lumbar arteries and there'll be only and only one single, don't write one pair, single median sacral artery, guys. So I'm done with the ventral branches, I'm done with the dorsal branches, and I'm done with the lateral branches, guys. Done, and done, guys. Lovely. That is about the branches of abdominal aorta. You can surely expect one question from here in the next exam, guys. Next concept to be revised, inferior vena cava. In the inferior vena cava, I just want you all to remember like only and only one point here right now. Yes, I hope in this diagram you are able to see the left gonadal vein. There will be a left gonadal vein here right now. And remember the second point here right now, I hope you are able to see this one will be the left suprarenal vein here right now. These two, left gonadal vein and left suprarenal vein, these two are going to drain into the left renal vein. They don't drain into the inferior vena cava. That's important. Left gonadal vein and the left suprarenal vein, both of them will drain into the left renal vein. You can very clearly see in the diagram there. That's important. Apart from that, right gonadal, right suprarenal renal, both the renal, right and left renal, hepatic veins, all the veins will drain into inferior vena cava. Every student knows that. For your exam, I want you to remember these 2 points here. Left suprarenal vein and left gonadal vein are not going to drain into inferior vena cava. They drain into left renal veins. Done. Next one, umbilical cord. Now slowly we are moving towards the embryology part. So that is your gut embryology. Now what will be the contents of the umbilical cord here right now, sir? Yes, write down there. Everybody knows that there will be one duct there. That is your vitello-intestinal duct. Vitello-intestinal duct. Number 2, everybody knows that in the umbilical cord you have got allantois, and everyone knows that it will be surrounded by a jelly-like substance known as Wharton's jelly. Wharton's jelly. This Till here, no student is like confused here right now, sir. Vital intestinal duct, allantois and Wharton's jelly, every student knows very well. Confusion comes in the artery and vein. And just few minutes before only I taught you, right and left, both umbilical arteries will be there, guys. You have got both the umbilical arteries, right and left umbilical artery hota hai, but in the vein there'll be only the left umbilical vein. And I taught you just few minutes before only, right will regress and left is left, guys. So therefore you'll be having only the left umbilical vein, but there'll be both the arteries, guys. Right and the left umbilical artery dono bhi hota hai, sir. Fine here right now, guys. Is it okay? So in the umbilical cord, you have got both vital intestinal duct as well as the allantois and the Wharton's jelly. But remember, both the arteries and only one vein. Two arteries will be there and there'll be one vein there, guys. Done. Rotation of gut, another very important topic nowadays. Will the foregut rotate? Yes, 90 degrees. In which direction? Clockwise direction, guys. Will the foregut rotate, guys? Yes, it will be rotating. In which direction? Remember, the foregut will rotate in clockwise direction. Okay. Will the midgut rotate? Of course, it will be rotating 270 degrees. In which direction? It will be rotating in the anti-clockwise direction. And I don't know why your examiner, MC examiner, is very much interested in the midgut rotation. And hindgut is not going to rotate, guys. Foregut 90 degrees clockwise, midgut 270 degrees anti-clockwise. Hindgut rotate nahi hoga. And now I'll show you something here right now. Look at this one and everything will become very clear, guys. Midgut kya hota hai na? In the midgut will be having like long loops of jejunum and there'll be long loops of ileum and all, guys. And that cannot be accommodated inside the abdomen at the time of, intrauterine life. That's the reason why what is going to happen there. Yes, what is going to happen there, guys? So during development, what is going to happen? Midgut cannot accommodate in the abdomen. So therefore, your midgut is going to come out through the umbilical opening. Look at this presentation here. The midgut is coming out through the umbilical opening there. And after coming out, it is going to rotate anti-clockwise 270 degrees. And yes, this one is your cecum, which is developing there. And this one is your small intestine there. And after rotating 270 degrees, what is going to happen? It will again reduce back. It will go back into the abdomen, guys. It is going to reduce back into the abdomen. So first, small intestine will return back into the abdomen, followed by the large intestine. The large intestine will overlap there, guys. Understanding my point here right now? And yes, you can see in the diagram there, this will be your small intestine there, guys. And that is actually overlapped by the large intestine there, guys. Okay, I think this makes everything very, very clear, guys. Crystal clear about the rotation of the midgut. So midgut loops will come out, they'll rotate and go back, guys. Lovely. And that's the reason why, my dear friends, can I call this one as hernia? Of course, yes. But it is like pathological hernia or physiological hernia? It is physiological hernia. So therefore, question number 1 here right now. Question number 1. When will physiological, that is your 6th week. When will physiological hernia reduce back into the abdomen? That is by 10th week. And you and me, we are very lucky people. Your midgut and my midgut, it came out, rotated and went inside. Your midgut and my midgut, it came out, rotated and went inside, guys. But remember, my dear friends, in some unfortunate babies, it will be coming out, but it will not reduce back. And the failure of reduction of physiological hernia is known as omphalocele. If the physiological hernia doesn't reduce back, that condition is known as omphalocele, and the baby will take birth with all that loops of intestines lying outside. That condition is known as omphalocele. So that's very, very important, guys. Next one. So we are left out with a very less time here right now, sir. So let us very quickly go towards the lower limb topic right now. Let us discuss what are the important topics to be known in the lower limb. In the lower limb, the very first thing that you have to know here is about the femoral triangle here right now. What is going to form the base of the femoral triangle, sir? Yes, I want everyone to concentrate here right now. Another 10 minutes, we are going to wind up here with the lower limb topic and remaining whatever important topics are there, guys. So please, I request all of you to fully concentrate here right now, sir. So in the femoral triangle, first of all, you can clearly see this is the ligament here, inguinal ligament, and that inguinal ligament is going to form the base. And laterally, you're able to find this muscle, that is your sartorius muscle. And medially here, you're able to find a muscle, and that muscle will be your adductor longus muscle, guys. Okay. So already it's present here written, guys. Base will be formed by inguinal ligament here. And laterally you have got the sartorius muscle there. And then medially you have got the adductor longus. And recently in the MC exam, the question was about the floor, and you can clearly see in the diagram here, the floor is formed by 4 muscle. Can you see this muscle, beautiful muscle coming from the ilium bone, iliacus? Along with that, this one will be the psoas major muscle. And then this muscle here will be your pectineus muscle, and this will be obviously adductor longus. So adductor longus is forming the medial border. Along with that, it is also present in the floor, guys. So how many muscles are going to form the floor? Number 1, iliacus. Number 2, psoas major. Number 3, pectineus. And number 4, adductor longus, guys. Lovely. Femoral triangle, we are done with the boundaries. Contents, no need to remember. Artery, femoral artery. There'll be a vein, femoral vein. And there'll be a nerve, femoral nerve, guys. इससे आसान कुछ नहीं है जिंदगी में. And there'll be lymph nodes here right now. Along with, yes, sometimes present, sometimes not present. That is lateral cutaneous nerve of the thigh. Sometimes it is present, sometimes not present, guys. ठीक है? हो गया बच्चों? So that is what you have to remember in the femoral triangle here right now. Acha, if you want to remember something more in this topic here right now, you have got the artery and the vein and the nerve, but remember their order of arrangement. It will be again in the form of van only, guys, but it is from medial to lateral. So first you have got vein, lateral to that there will be artery, and lateral to that you'll be having the nerve, guys. So arrange in the form of VA and van from medial to lateral. Okay, now welcome to the next topic. Yes, your favorite and the examiner's favorite, guys. That is gluteal region here right now. ये तो किसका favorite नहीं है ऐसा topic है ना? And please take another color, pen, pencil, whatever it is, and write down there, my dear friends. Definite question from this topic here right now. You're able to see the largest muscle in the body, gluteus maximus. Remove that gluteus maximus. You'll be able to find the medius and minimus. Let us discuss about these 3 muscles first of all, sir. Remember, gluteus maximus, it is the largest muscle in our body. Okay, ji, theek hai. Okay, and it will be supplied by which nerve only? Gluteus muscle, gluteal nerve. But your concentration should be on the inferior gluteal nerve. It is supplied by inferior gluteal nerve. And it is helping in extension at the hip joint. For example, you are sitting there, I am sitting here. Our hip joint is flexed. From a sitting position, if I am standing up, it will be extended, guys. So gluteus maximus supplied by inferior gluteal nerve, and it is helping in extension at the hip joint, standing up from a sitting position. Done. After that, the gluteus medius and the minimus, again both of them are supplied by gluteal nerve only. Gluteus muscle, gluteal nerve. But your concentration should be on superior gluteal nerve, guys. And that is actually helping in abduction at the hip joint, and while walking, it will stabilize the pelvis. Okay. Any injury to this nerve, I'm using this sign here right now, sir, that will lead to disturbance in your gait, and that will lead to lurching gait. I hope you have learned this already. You have to remember that. So superior gluteal nerve, if it is injured, it will lead to lurching gait. So I'll show you this diagram. Look here. In the first diagram, this is like normal gait here right now. The person is walking normally. Medius and minimus are perfect. Okay, ji. Agar मान लो the superior gluteal nerve is actually injured here right now, then these 2 muscles will be gone. Then the person will not be able to walk normally. Look at the last diagram. In the last diagram, the person is walking by bending his body on one side, lurching on one side there, and this type of gait is known as the lurching gait, guys. Lurching gait. And always in your MC exam, the same question, sir. Ghuma fira karna. He'll be meddling with the same question, guys. Okay. Superior gluteal nerve injury, medius and minimus. Which muscle involved? Medius and minimus involved. And yes, what type of gait will be there, guys? Lurching gait. And which sign will be positive here right now? Yes, the Trendelenburg sign will be positive here right now. So Trendelenburg sign will be positive here right now. Expecting this question in the next exam, guys. Okay, so Mr. Doctor is telling, sir, आप खतरनाक हो यार, मैं इतना सा प्यारा सा हूँ, आप मुझे इतना खतरनाक क्यों कह रहे हो, Mr. Doctor? Welcome here right now, sir. So Trendelenburg sign will be positive. Which nerve is involved? Superior gluteal nerve. What type of gait? Lurching gait. Which muscles are involved? Medius and minimus. Hope you will be able to answer here right now, guys. Lovely. Done. And after this, my dear friends, welcome. Here I'm able to find one small muscle, gemellus superior. And here this muscle will be your obturator internus. And below that there will be small muscle again, gemellus inferior. And then there will be a rectangle shaped muscle here right now, sir. And that yes, that rectangle shaped muscle here will be your quadratus femoris. Okay, quadratus femoris here. It is rectangle in shape, quadrangular shape. So therefore quadratus femoris, guys. Okay. Meet Patel is asking same side or opposite side. Remember Meet Patel, it will be opposite side, contralateral side. I hope you're asking about the lurching gait, you know, Trendelenburg sign. It will be, the effect will be always on the opposite side, sir. ठीक है जी, lovely. Now, so what about these four muscles, sir? I repeat again the name here: gemellus superior, obturator internus, gemellus inferior, and quadratus femoris. Gemellus superior, obturator internus, gemellus inferior, and quadratus femoris. They also belongs to my gluteal region only. Welcome. Gemellus superior, obturator internus, both of them are supplied by nerve to obturator internus. And then gemellus inferior and quadratus femoris, both of them are supplied by nerve to quadratus femoris. बड़ा आसान सा नाम है सर. So gemellus superior, quadratus in obturator internus, nerve to obturator internus, and gemellus inferior and quadratus femoris, nerve to quadratus femoris. And my dear doctors, yes, all these four muscles are helping in lateral rotation at the hip joint. Already asked in the exam, guys. It's helping in lateral rotation, okay, at the hip joint. Okay, thank you, thank you, Manasi. Thank you, Manasi. Thank you all for appreciation of my efforts here right now. So I'm doing all whatever is possible from my side, guys. So 110% beyond my extent, whatever is possible I'm doing here. And the only thing I expect back from you people is your result. I want to see all of you clear the exam, guys. I want to see all of you come out with the flying colors. I think this is like the easiest way and this is the quickest way where we can revise the anatomy, all the three sessions. Okay, we have discussed in detail here right now. So that is what I can do from my side, guys. I'm putting all my effort here right now. And please, I request all of you, don't try to, you know, इसको क्या कहते हैं ना, उर्दू में कहते हैं ये सारा मेरा जो एफर्ट है इसको ना ज़ाया मत करिए. डोंट वेस्ट माई ऑल माई एफर्ट हियर राइट नाउ. सो ट्राई टू कम आउट विद द फ्लाइंग कलर्स, गाइस. दिस विल श्योरली हेल्प यू टू क्लियर योर एग्जाम. many questions are going to come from here, sir. Okay, now last and final concept here right now. Yes, eversion and the inversion of the foot, guys. ठीक है ना, eversion and the inversion of the foot. For example, these are like my two foots here right now, right foot and the left foot. Right foot and the left foot. Okay, and the right foot and the left foot, there will be a medial border, medial border, medial border. There will be a lateral border and the lateral border. Okay, now if I elevate the lateral border of the foot, if I elevate the lateral border of the foot, it is known as eversion of the foot. If I elevate the lateral, okay, lateral border of the foot, eversion of the foot. And if I'm elevating the medial border of the foot, that is known as inversion of the foot. Lateral border of the foot is elevated here right now, yes, with the help of two muscles. One is your peroneus longus, another one is peroneus brevis. Both of them will be supplied by superficial peroneal nerve. Both of them will be supplied by superficial peroneal nerve. Okay. And now, my dear friends, inversion is actually done by tibialis, and tibialis is actually your two of them, tibialis anterior and tibialis posterior. Both of them will be helping in inversion of the foot. But remember, my dear friends, tibialis anterior is supplied by deep peroneal nerve, whereas tibialis posterior will be supplied by your tibial nerve. Okay, I'm done with the muscle helping in that. I'm even done with the nerve supply. And the only thing that they can ask you here right now is about the joint. Which joint will be helping in both eversion and inversion of the foot? And that will be your subtalar joint. Subtalar joint will be the joint which is helping in both eversion of the foot and inversion of the foot, guys. So eversion and inversion of the foot, they can ask you the muscle and they can ask you the nerve supply, and then they can ask you the joint, guys. And that's all about the revision of your thorax, abdomen, and you know the embryology part of the abdomen, embryology part of the cardiovascular system, and the lower limb topic. These are like very high topic, and I told you all, like, you know, which are the very important topics to concentrate on. I hope this will really help you all. Okay, so I'm really humbled here right now, guys. Thank you all for showing your trust on me and coming to my classes here right now for the last 3 days. You are continuously along with me. So I think these revision sessions will surely help you all. Okay, I'm really happy to help you all, guys, in your journey. And please, you know, aram se on the day of the exam, don't have any panic situation, any anxiety. Aram se go to the exam, cool and calm, and write down, and you will clear the exam. Because I believe all the students who have, you know, who selects MBBS as a course are something special. And you have studied for your last 5 to 6 years, guys. And after studying for 5 to 6 years, I think every student can at least perform 50% that MCA is asking for. From 300, you should get only 50%, 150 marks. And I believe more than you people. I believe in you. Whatever 5 to 6 years of effort you have, you have studied, you will surely able to clear your exam. Okay now, so I'll pray all for all of you guys, and God bless you all. You are surely going to clear the exam this time, inshallah. Okay, so yes, my dear friends, I'll pray for you, and you also remember me in your prayers. I think I have put all my efforts here right now, sir. 110% I've put my efforts to condense the entire anatomy and the most important things, guys. Okay, so please, for your parents' sakes, for your parents, sake, and for the sake of the teacher here, please clear the exam. Write the exam cool and calmly, guys. Okay, so thank you all, thank you all, thank you all, my dear friends. God bless you all. Take care. All the best, guys. Bye bye. Take care.